Good afternoon, everyone. I'm Dr. Sarah Mustafa from DentistChannel.Online. Welcome to today's webinar about how to become a UK licensed dentist. While we are waiting for the participants to join the session, I will introduce you to our company. DentistChannel.Online is a digital dental media company. It is your marketing solution for dental events, product launches, workshops, and courses. We also provide a collection of scientific articles and blogs about different topics in dentistry. We work hard to be your first-hand information on the technological advancements in the dental field. Now it's time to start the session about how to become a UK licensed dentist. If you have any question about this topic, please feel free to ask it in the question and answer box, and we will answer each and every question at the end of the session. I will start by introducing today's session speaker, Dr. Sarah Zubair. Dr. Sarah is a GDC registered dentist working in a mixed NHS private setup in the Midlands and is practicing as an associate with Together Dental. She is member of the Faculty of Dental Surgery and joint dental faculties at the Royal College of Surgeons, England. She graduated from CMH, Lahore, Pakistan with house job in 2016. Then she took her overseas registration exams and got the license to practice in England in 2018. Welcome, Dr. Sarah. It's our pleasure to have you with us.
Thank you so much. It's a pleasure to be here. And just before I start, I'd just like to say that you guys are doing such a brilliant job because you're just gathering dentists from everywhere who can speak about expertise in their field and the knowledge that they have with the other people who need it. So brilliant. Kudos to you guys. And thank you for having me once again. I just wanted to start with saying that the reason behind this webinar and this topic is how to become a GDC registered dentist in the UK is because I feel that in a world where every information is just a Google search away, and it's really easy to get information about a lot of things that we want to know about. I feel that there's still gaps in information regarding the ORE exams and GDC, the LDS, what it is, and whether they should go for it, how to get a seat, and things like that. And I feel that they should be addressed because they've been asked by my a lot of people have asked me these questions on my group, and I keep trying to make it a little bit easy for them, but I feel that there's a serious need because we need more dentists in the UK because the NHS is getting, I think we need more dentists. It's overburdened and we could definitely use more skilled dentists and practitioners here. So before I start, I'd just like to start a little bit with my journey about this. As Dr. Sarah has very kindly mentioned and introduced me, I'd like to say that I was an overseas dentist myself. I graduated from Pakistan, and then initially I went to the States for a while, and I did my board exams, and then somehow the plans changed and I had to come to the UK and did my ORE exams. Now I was lucky enough to do both parts, part 1 and 2, both in one go in the first attempt, and I did it in less than a year's time, both of the exams, and got in the booking for both of the exams. The first time I basically clicked on that. So I was one of the lucky ones, I think. So the reason why I'm mentioning these things is not because that, I'm a brilliant alien or I've done something extraordinary. It's just that I just want to make it look more accessible to people, that it is possible to get the ORE booking, to get to do these exams in less period of time, and there are just ways to get around it, which I'm going to talk about later on. So the objectives of this webinar basically is that, first of all, I'm going to talk about how to prepare for the exams, and what courses I would recommend if you're going to go for these exams. Secondly, I'm just going to talk about there's a great talk about the seats and the availability of the seats and whether they'll get in. And somebody was writing this on my Facebook group that there's no point of even trying these exams because you can't get the seats. So I'm going to talk about that and booking process and how you can and manage that, and tricks and tips to get the booking for this one. The third thing is that once you get done with these exams, how to become registered with the GDC, and the VTE training, how long does it take, and what do you require for that. After I'm done with that, I'm going to talk about pathways that in which you can just develop yourself after you've done all of these things, like postgraduate training, and what are the ways in which you can further develop yourself in the UK as a dentist. And then finally, I'm going to talk about how is it to work in the NHS, or a mixed private NHS practice, or private solely, if that is your goal eventually to work in the UK. I'll be talking about these things, and if you guys have any questions along the way, you can just pop them down, and we'll definitely, like Sarah said, that we'll just address it at the end of the session. So first of all, let's talk about, like I said, the preparation is the first objective. So a lot of people are confused about the preparation of the exams, and to be honest, when I was preparing the exams, for the exams, a lot of people said, well, you have to do at least 12 or 13 books for that. And I personally think that it's not fair to tell people that, because it's not practically possible for anyone to retain that kind of information. So I would say that all the exams, whether these are the American board exams, or they are ORE or any other registration exams, I think that you should always focus on the clinically relevant information, because nobody is going to ask you, about Kayser-Fisher ring from Wilson's disease or something crazy in the exam. They're just going to ask you, clinically relevant information and topics. So I keep mentioning this, the ways to prepare for the exam on my Facebook group as well, that there are many like ways while you can get help. So with regards to ORE1, this is how I did it. So I just did self-study, because a lot of people say whether you should do self-study, or you should, get into some academy to study. So there are ways and courses which can help you, but I did self-study, and I would recommend, like I always say, pink book, blue book for that, and then Eric White's from the radiology book. I keep updating a list on my group all the time, so please check that out. If you want to go for courses, I would say that yes, you can go for them for ORE1. It's just that they're a little bit too expensive. I think they would just cost you, like a Samsung course would cost you £800 just to get on that course. They will guide you about the clinically relevant information. So all the courses and the tutors, they are basically trying to get to you to read the relevant stuff and the things which are again and again frequently asked in the exams and are relevant clinically. And once you're done with that, so so that's about ORE part 1. So I'll just come to the preparation part of ORE part 2 now, which is basically, I'll check the questions after this one in a second. So about ORE2, it's basically, this is now the daunting exam, because a lot of people say, oh, it's impossible to pass ORE, so we might not as well even try to attempt it. For me, ORE part 2 was, to be fair, better than ORE part 1, and I had just had like 4 or 5 months to prepare for it, even less, I guess. I think the going on the right courses is the main key. and practicing on your mannequin is the main key to pass this exam. So for me, it was I went to Dr. Matten for the mannequin bit, and I went to MR Dental for the other bits. I also took revision courses because I said, well, I'm going to do it one time, but I'm going to do it right. So I would advise that whoever's going for this exam, just make sure that you just prepared very well for it. Like, you know, just give it one shot, give it your best, because obviously it's a very expensive exam and you are going to be spending quite a lot of money, so you want to get it right the first time. I think before I went to the exam, I would have, they have about 20-25 exercises, and I would have done each one of those at least 400 to 500 times on my mannequin. And if I got something wrong, I would just write the mistake and you know, try not to repeat that again. Also, to have somebody check your preparations as well, just to make sure that you're not practicing something wrong and repeating the same mistake, which can end up in the exams as well. So you just make sure whatever you're practicing is right. And after the preparation bit, I'd just like to come to the point of booking now. So like I said, that I get this question quite a lot, that people don't even attempt the exam because they say, well, there's no point because there are no seats, or the exam booking is almost impossible to get. I know that some people have been unlucky this way, but you know, first I'll talk about the tips to book the exam, and then I'll just share some new information that GDC is going to has updated on their website, which is a little bit of a hope for you, the ones who are trying to book for the exam. So the first thing is the booking of the seat. I think for me, I would suggest that when the exam booking opens, you're given a time on your email, you're sent a link about 4 to 6 weeks that this is going to be the time where the exam booking opens. So before the exam booking, I'd just say, just log on to your account so that you know your email and password about 5 minutes before the booking time opens. And after that, once you're done with that, you're sure that this is, you can get into your account all right. After that, about 30 seconds to 1 minute before the booking opens, I would say just open it again, refresh your page, make sure that your credit card for the payment is ready, and you just pay right as soon as you click on the booking, you pay it right away, and you have a very good internet connection, which is really necessary to so because you don't want to take any second chances, you don't want to miss the booking and stuff. With regards to the news that sorry, bear with me guys, I'll just check the questions in a second. With regards to the news that I would going to share with regards to the GDC website, they are going to increase the capacity for the exam. Next year they're going to make some changes, so there will be, because there has been a little bit of a there've been a bit of a lag because of COVID, so they will try to compensate for it by increasing the seats. They haven't really said how many yet, but they will definitely increase the capacity of the exam, because at the moment you've got ORE 1, which is held twice a year, and ORE 2, which is held thrice a year. So but and 200 candidates can appear at one time, but they will be increasing that. And the other thing I'd like to mention is that ORE 2, with regards to the people who have passed that 5-year mark, you have to give ORE part 2 within the 5 years when you've done part 1. So the ones who've missed that mark, there are about 120 candidates. So the GDC said they are going to reach out to them and going to offer them bookings for the exam, so they wouldn't lose their part 1 with regards to that. And then so one objective was preparation. I've come to the second one, the seat booking. So I would say about this one, please don't lose hope. you will eventually get the seat. You will eventually get in. So please don't, not take the exam just because it's too difficult or you never get the seat. So, it is possible because a lot of people did apply for it and they did get in. Uh, the other thing I would like to mention is that if you don't get a seat in ORE, you can apply for LDS, which is like a counterpart of ORE. And it's the same like licensing exam. You can get licensed to practice in the UK either by doing ORE or the LDS exam. So if you don't get in that, try an LDS. They're both similar exams. It's just that the slightly difference is that I think there's less information regarding the LDS that is available. And the other thing is that the part two, LDS part two, while you've got 5 minutes for the OSCEs and things like that for ORE part two, you will have to do the same thing in about 4 minutes 30 seconds. So it's a little bit I would say like a little bit short on time sort of thing, and a little bit less guidance. But again, you can get your license. People have done it by either of these exams. The third thing I would like to mention when it comes to the licensing is, one, there's ORE, the other thing is the LDS. And the third route used to be, I would say, it still is, till the next year, which is finishing next year, is that you can do like a hygienist job, or you can do a therapist job without by filling on some forms and without doing these exams. But I confirmed it with the GDC that they're going to, first of all, finish it next year, and secondly, the people go through these routes. There are some agencies which help them, like working as a hygienist and stuff. But I would say that most of them, it's a very tough shot. Like, they would at least want you to have ORE part one to work like a hygienist while you're working and preparing for your ORE part two and things like that. So a lot of people are keen on this route. That's why, because they didn't want to do these exams, or they didn't want to do ORE first and have some money to pay for these exams, which is totally understandable. But they're finishing this route next year, and I just wanted to tell you that I think that the best way would be to generate some money at your home country, like work a little bit at your home country, and then concentrate on these exams, because as soon as you get done with that, you can just go into practice and you can generate your revenue and go ahead from there. So now we come to the part where we've done ORE part one, part two, and now it comes to the registration of the GDC registration. Now, for me, it was that after doing ORE part two, I just got my registration in about 4 to 6 weeks afterwards. But just make sure that for the registration, you've got your IELTS ready, and you've got just have a look through the documents. You've got your both of the certificates, and they ask you for your academic transcripts and things like that. So make sure that all of that is ready, so that you're right there. As soon as you pass your exam, you're just ready to apply for that, and then go ahead with your registration. So that's the easy bit. As soon as you're done with the ORE, you get your GDC registration fairly quickly. Now we come to VTE. So I'd just like to explain what it means, first of all. So VTE is basically like a vocational training. It's like we do our house job in our home countries. So it's basically like that. And so you have to spend a year under a mentor, and just show them a couple of exercises that you've done, and they check how you're dealing with your patients and things like that, make you write some reflections and things for a year. And then after that, you get a performer number, which makes you eligible to work independently in the NHS. Now, after the GDC, you can either plan to go in private practice and not go to this performer number route, or you can go to the VTE route and get your performer number. I would recommend doing this because a lot of private practices here, they would just require you to have some kind of experience of working in the NHS, and your performer number is that experience, so you would want to have that in your CV, and that makes getting jobs really easy. And with regards to my VT, I ended up getting one 4 months after my GDC. One thing I would like to mention is that once you're applying for your VT training, there are two forms that you need to fill: the PLVE form and the LPL1 form. A lot of people fill the NHS form and then wait for them to reply to you for about 4 to 5 months. And while you're waiting, I think you should just fill the other PLV application as well. Because otherwise, if you're waiting 4 to 5 months and because the PLV application is really, really big, you're basically essentially wasting those 5 months. I think you should just, once you apply for that, you should just basically apply for both of the applications at the same time. As soon as you get an offer, you submit the other application as well. So um, you'll get more clarity on it once you get into the system. It's a little bit difficult to explain here. Um, a lot of people say, well, there are no jobs in the UK. Even after getting GDC registered, there are no jobs. You're never going to secure a job or a VTE training. That's not true. I would say, as I've hardly seen any GDC registered dentists without a job, unless they choose not to work. So there are a lot of jobs in the UK. With regards to the visa and things like that, there are a lot of jobs who offer visa sponsorship as well. So if you don't have a work visa, I had a work visa. So probably that hastened a little bit things for me. But then again, there were jobs who were offering sponsorship for visa for 1 year as well, which you can go ahead with if you don't have the visa. So you don't have to worry about that. I think, again, I would say just concentrate on your exams. Once you're done with that, everything becomes easy. With regards to now the fourth thing I would come to, our objectives, the options in the UK after you become a GDC registration, you've done your VTE training. We come to the options of postgraduate training. Now, with regards to this topic, I categorize it in four things that you can do to develop yourself professionally. One is that you can develop yourself once you're done with this VTE and things like that. You get a fair lot of training in the VTE because you're working under a supervisor for at least a mentor or supervisor for at least a year, and they send you on a couple of courses. So you get a hand of how things work in the NHS. If you want to develop yourself further, you can go on to courses. They're very good courses, like implant courses, whatever your field of interest is, and Invisalign and things like that, and you can develop yourself according to that. And you can then the other thing is that the courses, they're year-long courses, diplomas, like I said, or they're 1-day, 2-day courses which can help you develop yourself. Eventually you can move from NHS to a mixed private or private practice. I'll talk about these in a while. What's the difference and what are the rewarding points and things like that. So one is that I personally did courses during my VTE. I took quite a lot of them, like all sorts of things, which really helped me, like crown bridges, veneers, all sorts of things that you can talk about. But my interest is aesthetic dentistry, so I did a year of diploma with restorative anesthetics with the Royal College of Surgeons, and then now I'm just doing a year-long practical hands-on in totally aesthetics, which in which they teach like veneers and things like that, because that's my area of interest, and eventually I'll probably want to pursue specialist training. The other after courses, the other way that you can develop yourself is to enroll yourself into a master's program. Now, you don't have to do that. I mean, you can just practice as a GDC registered dentist, and do what you love, and don't have to go for masters. But the ones who want to like add a little bit more to their CV, or they have a certain area of interest, there are three ways of going for a master's. So one is like you can just enroll yourself on a university program, which is about 2 to 3 years, temporary or full time, for a master's. And I always say, do your master's after your ORE, because a lot of people do master's first and then ORE, which doesn't really make sense to me, because it's well and good, like it's something in your CV, but I think that do this the other way around, because obviously it goes in your CV, but if you've just got masters and you haven't got ORE or any licensing or registration, things like that, you won't be able to practice in the UK. Like if you've got a master's in public health or something like that, you will not be in clinical practice. You can get an administrative job in a hospital or something like that, but it defeats the purpose of working as a dentist in the UK. So if that's your purpose, do ORE or LDS first. So I was talking about the ways to enroll into a master's degree. You can associate yourself with the university, or there's a cheaper way of doing masters, which basically the route I took was there's a 2-year diploma course that Royal College of Surgeons is running. And after 2 years, you can spend the 3rd year in a university. And after those 3 years, basically you get a master's degree. Now the good thing about this is that it's cheaper, because university would cost at least 25 grand a year for a master's degree. If you're doing it through this diploma route, it's about 9,000 pounds a year. You can easily pay that from your pocket while if you're working. So you can do that alongside, because it's not full-time, it's on site. You don't have to be like full-time in the university to do that. And the third thing is that you can do masters through just enlisting yourself into something called clinical masters, which is MClinDent, which is quite famous. Well and good if you've got the money to do MClinDent. It's good. I've heard good things about it, but again, in my opinion, it's quite expensive. The people who've done it, they say good things about it. Then there's a lot of money involved. Like one year will cost you around 35 grand, something like that, for about 3 years. Even more if you're doing it from King's, or if you're doing it from other universities, it can go that. So you can the first one, you can either develop yourself through courses. You can enroll yourself into masters. There are 3 ways of doing a master's: either the diploma route, a university route, or you can enroll yourself into a clinical masters, which is MClinDent. Or the third one is that you can go into the third field, how you can develop yourself. You can go into specialist training. Now, for specialist training, you have to basically train in the hospital for about 3 years, depending on what field you choose. So it can range up to 3 years to 5 years. And for that, to get into specialist training is a little bit, because you're competing against the UK graduates as well. But again, it's not impossible. If you are interested in that, you'll need MJDF, you need performer number, you need some kind of CPD in the area of interest of what you want to apply into. But at the end of this training, you get onto the specialist list, and You can either work as a consultant in the hospital, or you can, own your own private practice, because it teaches you a fair lot. A lot of colleagues of mine who are doing this, they've got amazing things to say about it, because they learn quite a lot. They deal with those complex cases, and it's great if you can do that. And the fourth thing is that if you're not clinical, you can go into like teaching. You can do like teach at a university and things like that, and you'll need a master's for that, or something related. Or you can go into things like academic research fellowships, which or hospital-based fellowships, in which you can do research, and they can offer you funding and things like that. So that's one way of going, or administrative jobs and things like that. Now, the last thing that the objective for today was that how is it to work in the NHS or the UK? Is dentistry rewarding in the UK? A lot of people ask me that, and so I would say that initially, yeah, I would say yes, definitely it is rewarding. In dentistry is rewarding in the UK, as long as you get to practice what you love to practice. So if you go for your exams and your ORE and stuff, obviously in the first training year, a lot of people, obviously financial incentive is an incentive for all of us. In the first training year, you're a little bit tight on that, but once you're done with that and you're done with your performer number and stuff, an average UK dentist earns about 70 to 80,000 per year. And if you're in private practice, it can go up to 90,000 to even 200,000 a year, depending on what kind of expertise that you have, whether you place implants, you do aesthetic work, veneer work, how. And now I'm talking about how is it to work in the NHS. NHS is quite busy. It is, I mean, you're seeing a lot of patients on your NHS days on a daily basis. Eventually, what people do is, like a lot of dentists, because it's the load of patients is overwhelmingly high now. They end up working, moving from NHS to maybe like a mixed practice or a private solely practice. But again, like I said, that you have to develop yourself if you want to go in that route. And you can also choose to do like a mixed NHS or private. You can do certain private days and you can do certain NHS days. The good thing about the NHS is that if somebody's practicing after a long time, because you're seeing so many patients on a single basis, it makes you really fast, and it makes you like, it gives you like this really grueling sort of training. So you're not missing on anything. You're extracting a lot of teeth, you're missing a lot, you're filling a lot of teeth, you're doing a lot of root canals and things like that. You're doing lots of crowns, bridges, so you do get a lot of experience. And once you're done with that, you can like I love aesthetics, so I eventually developed myself in aesthetics, and I now do that about 2.5 days private and about 1.5 day NHS, and I quite love it, especially my private days, because I think I get to practice what I love to practice. With regards to my last thing is that and there is help available on if you check out on Instagram, there is I've attached a link to my Facebook group where I constantly post like clinically information that is clinically relevant, things that they're going to ask you in the exams. Obviously no one knows the exact exam questions. We're not even allowed to share them, but obviously you can talk about the clinically relevant topics and things like that. So do check that out. You can find the link on my Instagram, or if you've got any other questions, you can message me on the Instagram, and you know, we can clarify any problems that you might have. And yeah, that's all what I've got to say, and I'll take some questions now from you guys, because that's yeah. So, Sarah, is it all right to take questions now? Yeah.
Yes, let us take them at the end of the session. I can share a short presentation right now, so participants will have time to type their questions. I would like to thank you so much for this informative session. It was very clear. It was a nice presentation.
Thank you so much.
So this is our organization, Dentist Channel Online, Healthy Smiles, Wealthy Lives. Dentist Channel Online is India's first digital dental media company. We did webinars and courses with more than 400 national and international speakers, many successful word implant expos, workshops, and webinars. If you're not a Prime member yet, kindly join our family to get free certificate of participation after every event and get exclusive offers and discounts on our online and on-site paid workshops and courses. Most importantly, Prime members will be awarded with 1 CPD CE point for each free webinar. You can use my code SAR100 in order to benefit from a discount. This is an example of the certificate of participation that you will get after every event. About our upcoming webinars, we have a webinar on August 28th with Dr. Amit. He'll be talking about fourth dimension in orthodontics, why timing is important, and another one on September 1 at 10 a.m. Indian Standard Time with Dr. Muhini. She'll be talking about role of laser in periodontal therapy. I request all the participants to kindly save this number and then send a message on WhatsApp with their name, so they will be added to our broadcast list and they will receive everything about our upcoming dental webinars and courses. Today's webinar is sponsored by NovaMind. NovaMind offers a full spectrum of implants and prosthetic solutions that accommodate any clinical need in modern implantology. We successfully supply highly demanded dental implants types called internal hex, tissue level, bone level, and active conical connection. Our EU production unit and product quality is appreciated worldwide. Dental implants and dental restorative solutions produced maintaining all the standards of EU medical device regulatory. Products are manufactured in Athens, Greece, and distributed worldwide with more than 1 million happy restorations. If you want to know more about NovaMind, kindly check their website. And last but not least, don't forget to follow us on our social media platforms, Facebook, Instagram, and YouTube. So now we can move on to the question and answer session.
Yeah, of course.
Okay, so the first question is it better to give MFDS Part 1 before the overseas registration exam, and would it benefit in any way while giving the ORE?
Yeah, that's a very good question. And I wanted to address that actually, because to be fair, I straight and short, I think it is better, because I myself did MJDF, which is the counterpart of MFDS. It's not completely similar, but they are similar, I would say, before ORE, because the clinical part of MJDF helps you in preparation of the clinical part of ORE. So you kind of be reading the same books that you're reading for MJDF clinical part as you are reading in ORE. So when I did my MJDF part 1, I did the pink book for the clinical part, and I was reading the radiology book and the BDA sheets and the guidelines, and it's all relevant to the preparation of ORE. So I would say that if you're waiting to get a seat in ORE, yes, do your MJDF or MFDS, whatever you can get in first, and then go ahead with that. And then I would say MFDS part 2 after ORE 2, because you know, you are so prepared to talking to patients and treatment planning bits and after ORE2, that you're doing the same things in MJTF or MFDS, talking to patients and stuff like that. So I think do it that way. It'll be beneficial.
Okay, doctor, another question. Which diploma course you did?
So my diploma course was right after my VTE training. I just wanted to develop myself more in the things that I love. So it was restorative and aesthetic dentistry diploma in from Royal College of Surgeons. And once you are done with MJDF or MFDS, the members of the Royal College get £1,000 discount on the diploma. With regards to this diploma, it definitely improves your theoretical concepts in restorative dentistry and things like that. I would say that it wasn't very hands-on, but still, like, you just get to read so many articles and stuff. And it's a cheaper way. Like I said, if you do 2 years of this diploma, you can go on to master's in the 3rd year in any university, Leeds, Plymouth, Kiel, because these CPD hours count towards the first 2 years of a master's. So it's a cheaper way of getting a master's. So yeah, I did with Royal College, and now I'm doing another one, which is totally aesthetics.
Okay, so for the overseas registration exam, we require 1,600 hours of clinical practice. Does it include our time spent on patients during our bachelor's?
Yes, you can keep that into account. So like if you're working in like in 3rd year, 4th year, if you have that charted somewhere, like a quota, if you've got a logbook of evidence that I've seen X amount of patients, but ideally I would say 1,600 hours of clinical experience where you weren't under supervision, so individual clinical experience, which you get in your house job. So if you've done your house job 1 year, well and good. Even if you've done 6 months of house job, get a good standing certificate with that, and it should cover your 1,600 hours, and you can add your 3rd year, 4th year experience from that. I personally did that. I added my experience from 3rd year, 4th year, but I had completed my house job before sitting for the OR exam.
Okay, another question. Apart from blue and pink book, what else and from where we have to cover?
Sorry, say that again.
Apart from blue and pink book, what else and from where we have to cover?
Okay, so apart from pink and blue book, I would say there is a really nice book, Eric White's for radiology, because there are a lot of radiology questions. And then the other thing that you can do is that you can get any concepts that you're struggling from, go check out mental dental videos. They're really nice on YouTube, a good nice resource book. And then I checked it out, because I've literally put a full list of study material on the Facebook group. So if you check that out, a lot of people say Master Dentistry Volume 1 and 2 is important as well. With regards to that, I didn't personally do all of those. I just did pink book, blue book, Eric White's radiology. There's another book, Clinical Dentistry by A.R. Banerjee, which I did, which is really good. Then on top of that, guidelines, BDA sheets, which a lot of people ignore, ethics, which a lot of people ignore, because most of the chunk of the exam is going to be that. But do check out a detailed list on my Facebook group. I keep it's on the file section, so you'll get more information on that.
Okay, doctor, can you type please the name of your Facebook group?
Yes, of course. So it's I'll do it in the chats. Yeah.
Yes, please.
And it's the link is on my Instagram. So if somebody's struggling to find it like this, I can just if they go on to my Instagram, which I'll just share.
Yes.
It's right under my Instagram. So you can find it there. And I'm just sharing the Instagram as well. Yeah, so I've done that in the chats.
Okay, doctor. So another question, how to get updated BDA sheets?
Okay, so there are many, the important ones I've updated in the group. I've put them in the file section in the group, so you can just download them from there. I would say radiation protection, infection control, health and safety. These are the important ones, and they always waste disposal. They always ask questions through these main ones. If not, you can become a BDA member, which is £70 a month, and you can get the BDA sheets. You can download it from them directly, or you can ask me. I'll send them over.
Okay,
Yeah.
do we need to cover the whole blue and pink book or just the important ones?
Say that again, sorry.
Do we need to cover the whole blue and pink book or just the important ones?
Okay, so I would say that I I did the whole of Pink Book at least for about 3 or 4 times, every single line of it, because I think that was my shortcut. So I think I did it like 3, 4 times. So whole of Pink Book. Blue books, I did parts because nobody can cram the whole blue book. And considering that I had done my American board exams, just the part 1, so the basic sciences I had already covered from that. So my basic concepts were clear. I would say focus more on anatomy, like nerve supply, blood supply of face, all the important things which you should basically know for as a dentist. You know, it's common sense. And physiology, they ask questions about oral path physiology and things like that. But again, I've just written it all on this study material section. I've also made some compile notes regarding this, which can help you, which are about the clinically relevant topics, which are asked again and again, which you can ask for them on the group, or you can DM me for those.
Okay, another question, is E different from DFT?
VT difference from the FT. So VTE is based on a clinic. In a clinic, you'll be working in so to apply for the VTE, you'll be working in a clinic under a mentor. Most of the times you have to pay the mentor at least a fee for a year, which is deducted off your whatever you're earning. So like I said, that the first year is going to be a little bit tight, but you have enough money to survive, to be fair. And FT is, it's called DFT now, it's Dental Foundation Training. It is hospital based, so you're, and you don't have to pay the mentor for that. It's a hospital based job, but it's more competitive to get into DFT. And it's more like scrutinized. The things that you're doing and the portfolio is much more difficult than VTE. But again, not impossible. I know people who've got into DFT, and the people who want to go into specialist training eventually, they should go for DFT because a hospital-based experience is going to help them, get the specialist training application. That experience is going to add up to that, if that makes sense.
Okay, doctor, I think this is the last question. How much it will cost for the ORE exam, covering all the expenses?
Okay, so ORE part 1 is £800, and you need to be coming here, which costs at least, I would say, £1,200. Cost of living for at least two days, at least about I'd say £200 to £300. So you're looking at about £2,500 for ORE 1. For ORE part 2, if you pass it in the first attempt, it will cost you about £6,000 to £7,000, because £3,000 is the exam fee, and You'll also be buying the equipment, which is at least 1,500 pounds. You'll be you'll be paying for the courses, which are at least 1,500 pounds. If you go for revision courses, another 1,000 to 1,500 pounds. So the ORE2 is the expensive bit. So it costs around 600-700, can go up to 9,000 if you don't have relatives here and you're living here on your own. Uh, with regards to that. But a lot of people, what they do is, the convincing part is that they do ORE part one, work as a hygienist or a therapist. You can get a job, as a hygienist. After that, they gather the money and they then go for ORE part two.
Okay, doctor, that's it for today. I would like to thank you so much for sharing your
Okay.
knowledge and experience with us. It was a very nice presentation. We had a lot of questions, and it was very nice, very clear, and very informative.
Yeah, no, thank you. I'd just like to say that again, like Dentist Channel Online, I just saw it and I was like, oh wow, these are just so clinically relevant things and topics that they're talking about. So it's amazing. I really like your channel as well, and I'll be
Thank you so
promoting
much.
it in my group as well.
Thank you. It was a pleasure having you on our platform, and we are looking forward to organizing more webinars with you with the future, inshallah.
Yeah, of course.
Thank
Thank
you.
you.